Pope John Paul II underwent a successful operation yesterday to insert a tube into his throat to relieve his breathing problems. The procedure is known as a tracheotomy. Now, as doctors say, the 84-year-old John Paul II is breathing on his own. For a better understanding of this medical procedure, we're joined by Dr. Charles Kimmelman. He is an ear, nose, and throat specialist, and I appreciate you joining us. There's also a term for it. I'm not going to try, but you say what you are.
I'm an otolaryngologist.
And now folks understand why I didn't try to say it myself. Let's go through, if we could, we have a model here, and explain what happens in a tracheotomy.
Well, the performance of the operation involves making an incision in the lower part of the neck.
Let's point to the model here.
In this model, this is the inside of the neck. So the neck is here, and this is the chest.
Okay.
And the lungs and so on. The voice box and windpipe, or trachea, are right here. This is the thyroid gland. In making the incision lower in the neck, I'll demonstrate on myself,
okay,
the opening develops right here, and we make a cut after we dissect down through the tissues, and inside that cut we widen it and place a tube.
Now let's get a shot of the tube, which you are holding, and hold it up to your neck so we can get a shot of that. This goes into the neck. Okay, now turn it sideways so we can see this. Okay.
Now the tube, as you can see, has a cuff on it, and you can inflate the cuff. I haven't inflated it now, but this seals off the airway so that the air going in from the outside goes directly into the lungs and back out. Nothing goes above into the voice box or throat.
Maybe this is obvious, but what is bypassed by using this?
Everything above the opening, so therefore the voice box, the throat, the mouth, the nose.
Okay.
No air will move through those areas.
What is the danger of this kind of thing? What are the risks? Pneumonia, that sort of thing?
Yes, pneumonia,
Why?
infection of the area, because you can introduce bacteria into the lower part of the airway.
Right.
Bleeding can also occur. And even later on, because on the model you can see large blood vessels coming from the heart, to and from the heart, they are at risk too during the operation. So great care must be taken.
Can he talk?
Right now, he can talk if this cuff is deflated. Therefore, when he breathes in and out, some air will go around the tube back out the normal way.
Can he eat?
Yes. This does not affect the food passage itself.
Okay. What's the prognosis of something like this on an 84-year-old man and has Parkinson's?
Well, it is somewhat difficult to say, but he is in dire straits. The infection itself is a problem. He has problem breathing to begin with. His underlying conditions with Parkinsonism also make it a great risk. The operation itself is not that risky, but it is the attendant problems that he has.
Okay, and that's what they continue to keep an eye on as well. Dr. Kimmelman, thank you very much.